work on pretty much one. I mean, you obviously work on one client at a time in the studio. I mean, with COVID-19, like what are I mean, your protocols were pretty severe to begin with. You're basically, you're dealing with people's heads and whatever, and sweat, whatever. What have your protocols changed? Like, give us a bit of what you're doing now to sort of deal with COVID and your business.
Sure. Do you want to go, Trev?
Sure. Yeah. So how clients go through the process is, again, just like going to any type of doctor's office or dental office, we have a pre-screening questionnaire that we send to them the day before, where they have to evaluate their own terms of health. They send a text message back saying, I agree to the terms and I'm healthy. They just enter with their own masks. As soon as they enter, we take their temperature to gauge if they have any kind of fevers or any other type of ailments. With their mask on, they Purell or sanitize their hands with 70% alcohol, and then they take off their shoes and they go walk right into the studio. Studio is entirely clean with a Cavi spray, which is a specialized, highly antibacterial spray that we handle on all areas and products that are touched by human hands. And then they go right into session 1, where they lay in the bed. The vet works behind that client's head, completing all of the 1,000,001 dots. So it's a pretty normalized process. They're just wearing their masks, as we have our face shields and our own masks as well. So COVID is not a huge change for us, to be honest. It's more of a change for the client to simply wear their mask. It's nothing necessarily different because we already had those high standards of sanitary requirements.
Right.
It's kind of awkward. I had to wear a mask.
We also
cut on Friday.
You had to wear a mask at your haircut on Friday?
Yeah, it was really weird. It's like you're going to the hospital to get some surgery done. You're standing there with mask. I don't like it. I went to a patio. The server's wearing her mask. I'd rather just stay home where I can pretend things are just normal.
I know. It's definitely a tough thing. Like, it's a transition for everybody. And the thing is that, we get audited by Durham Region Public Health on a regular basis. So we just have to ensure that we're following all these things. But yeah, I mean, it's not so fun.